Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, we're continuing our research into the drugs that are used to treat central nervous system disorders, central nervous system pharmacology. And our next class of drugs are the psychotherapeutic agents. Now, these are usually divided into two groups, the typicals and the atypicals. The typicals would be drugs like haloperidol or Haldol, which were great drugs, but wow, really did cause what I like to describe as zombification. Patients really weren't able to do much when they're under the influence of these drugs. They weren't really able to react to their environment. They weren't really able to function very well. Atypicals, which don't inhibit dopamine as much as they also inhibit serotonin, would be drugs like risperidone or Risperdal and olanzapine, Zyprexa. Well, what are these drugs used to do exactly? Well, they're used to treat various psychoses, schizophrenia, psychoses of known origin and unknown origin, as well as bipolar disorder. So quite a few uses for these drugs that are now considered mainstream in not only treating bipolar disorder and psychoses, but sometimes used as an adjunct in treating depression. Well, while that matters greatly to us as far as your patient's mental health and the systemic health, what would be some impact on dentistry? And of course, that means the potential for causing EPS, extrapyramidal syndrome or symptoms, dystonia, or a lack of tone in the muscles that control the tongue, the jaw, the neck. Now, this type of dystonia is reversible. So if you continue to take the drug, you'll have these symptoms. But if you were to discontinue the drug, this type of dystonia would cease. However, when you take these type of drugs for longer periods of time, years at a time, there is a potential for this type of dystonia to become permanent. And in its permanent form, it's referred to as tardive dyskinesia, which is problematic for us in dentistry and dental hygiene because patients with tardive dyskinesia sometimes have an uncontrollable, irresistible urge to open and close their mouth and stick their tongue in and out and lick their lips and open and close their mouth repeatedly. And so that can interfere, obviously, with what you do every day, certainly. It makes it difficult for you to render good care. But it also potentially can cause harm to the patient and you. So it's important to know this up front. It's important to know about the medications they take and what the side effects of those medications may be, especially long term. In addition, these drugs cause some significant central nervous system depression, which may be additive to any opioids that may be prescribed to treat pain. And of course, you realize these medications probably end up causing xerostomia, which can be even more problematic for patients who, because of their dystonic reactions, can't render good self-care. Well, this has been another episode of Fast Facts Pharmacology, and I'm looking forward to seeing you all again next time. Be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.